Good evening, friends. I thank Dr. Nirmal, the Chief Instructor, for this wonderful opportunity. I have no financial interest in this presentation. It's a very, very important topic, patient communication skills. My job is made easy because of all the previous speakers, especially Dr. Sunita told much about how to communicate in a hospital setup. So prepare yourself for the optimal exchange, give full attention to the patient. Listen, this is what we lack in most of the cases. We have to listen to what the patient says rather than jumping into some conclusion and treating what the patient has not come for. Create an environment that enhances a true exchange and connection. Acknowledge the patient by name. So this gives a very positive outlook from the patient point of view. Second time a patient comes, you acknowledge, you call him by his name after having his case record in front of you. So that gives a very good impression to the patient. Introduce yourself the first time. Share some other information about yourself. And sit near the patient rather than stand. Make an eye contact with the patient. Be aware of your body language because you will be watched each and every second you are spending time with the patient. Those few minutes, they are very really crucial. So you have to be aware of your body language. Reassure the patient through the power of touch. Engage also the family members. You have to recognize which is a key member in the family who will make decisions and try to convince him and make a involvement in all the decision making processes. Provide information and confirm understanding. Explain slowly and clearly in small doses, giving the patient adequate time to process the information. For us, it is a millionth of a patient, but for that patient, it's a particular incident or particular surgical procedure he is undergoing once in a lifetime. So we'll be bored of explaining, but there's no other go. You have to explain to the patient very clearly and very simple terms. And you have to get the feedback from the patient whether they understood it or not. And use technology as appropriate. You can show some pictures or videos to highlight that point. And ask for the feedback about your communication, whether each patient understands things in a different way. For example, that consent, that whatever has been projected earlier, after getting the consent, what is the patient's experience? Only very few patients understand almost to 80 to 90% of the content. Majority of the patient, they just think it's just signing a form. So you have to find out how much the patient has understood what you explained. Some tools we can use, patient and family communication boards which we can display in the outpatient setup in the waiting lobby. Educational videos can also be played, educating about, for example, in our setup about the importance of screening for diabetic retinopathy or the prevalence of glaucoma, in which the patient may not be aware, all the silent killers of vision. And some notepad we can display questions for doctors and nurses, caregiver photographs, communication with the family members. And what are the barriers to effective communication? Lack of knowledge or skill, particularly the doctor is not aware or not specialized in that skill, they may not be able to explain in a very clear way. Language barrier is also there. Underestimating the importance of communication. Most of the time we'll try to just finish off the OP or send the patient quickly, dispose the patient. But we won't give much time for a patient because every minute is important for us. There will be a waiting load of patients in the outpatient department. Giving low priority for communication, lack of time, confidentiality and inconsistency. Every time you have to provide the same type of information. If you are inconsistent, then the patient doubts your skills. And certain key phrases which you should not use or which you can use in a better way. For example, few things I have coined. Instead of no, I can't or what I can do for this type of situation. Instead of using I don't know, you can say I'll find out for you. Or this is not my job, or I'll get someone to help you instead. This is not my fault. So let's see what we can do about this. So certain things we have to change to a positive approach. So you have to, again I'm emphasizing, listening is very, very important. Hear the story, empathize, apologize, respond to the problem, and then finally you thank them. Consent is very, very elaborate. It's just not a single form or single event where the patient takes down the paper, doesn't even go through it, you don't give time for it, signs in the end. It is an ongoing process and begins pre-operatively, continues throughout your procedure, so operative or post-operative phases, and it should result in a clear understanding of the rationales, risks, benefits, alternative therapy, and realistic expectations. So we have to spend more time in consent. This will clear around 80 to 90% of your medical legal problems. Emphasis has been given already. There are lots of consent forms available in each and every areas procedure. Starts from admission, consent for procedure, surgery, treatment, anesthesia, high risk, in transfusions, donors, consent for MRI, so many things are available. You can formulate your own consent form and see to that it fulfills all the materials. Important parameters, disclosure of risk you have to tell. Possible alternative treatment is available for this procedure or not. Experience with surgeon is also very important. Risk from anesthesia if you are using. Off-label use you have to emphasize. You have to mention before subjecting the patient for this medication. So risk factor, in a recently published study looking at malpractice predictors and risk factors for ophthalmologists performing refractive surgery, improper consent was found as a main cause for negligence in 30% of the claims. So consent is very, very important. So it can be in the form of verbal and also diagrams you can illustrate to explain the procedure, audio visual displays, or benefit of repetition of information. So if you repeat twice or thrice, the patient may understand it in a better way. So start the consent process early. Include all the family members in the discussion, especially who will play a role in patient's consent. Sometimes patients themselves will be dependent on their key family members, so involve them as well early. Be frank and honest about clinical uncertainties. Don't give a 100% cure or something like that. Give the patient a copy of the form. They can go home, go through it leisurely and come back the next day or day after and give the form. If the patients appear troubled over the risk and uncertainties of the treatment, what you mentioned in the consent form, empathize with their wish for a good result without making any unrealistic assurances. That's very, very important. Otherwise, that particular patient will definitely go in for some trouble or complications and will be in soup.